Welcome to the Gum Guru, the podcast where we talk about all things gums, implants, and oral health. In each episode, Dr. Macon Singletary of North Raleigh Periodontics shares tips to keep your teeth and gums healthy.
Welcome to the Gum Guru podcast. Thank you so much for being here with us today. I'm Jason Kong alongside Dr. Macon Singletary of North Raleigh Periodontics. Dr. Singletary, how are you doing today?
Doing great. It's summertime, my favorite time of the year.
It is a wonderful time of the year to be here. It's hot, but you know we'll be complaining about the cold before it gets too hot.
That's right.
Well, we've got a wonderful show outlined for today. We're going to be talking about things that you can notice about our health just by looking in our mouths, and within just a matter of minutes. And I'm really fascinated by this because you have a big amount of experience in this field, and so I'm really intrigued. You know, the 5 things that you can tell about our health just by looking into our mouth.
Well, yeah, and probably there are more than 5, but you know, we say 5 off the bat. You know, and it's really a matter of it's like being a detective and being cognizant of what's our normal oral anatomy looks like. And once you've been doing this a while, you begin to understand, you know, there's a difference between, you know, somebody that comes in with a healthy mouth and then some that come in with deviations from that. And then trying to diagnose, you know, what's going on. And, you know, we're talking about artificial intelligence a lot this day and age, and there's really not a way that artificial intelligence can interpret the oral cavity, even with a photo. There may be some things with a photo that they may point out, but there's other things that got to be determined, and it's really a simple thing, but it's just being aware of what anatomy looks like.
Well, it's good to know that you're safe from the AI coming for all of our jobs, that yours is one in particular that will stay safe. So let's dive into that a little bit more. I mean, obviously, yes, there are more than 5 things that you could probably tell about our health, but what are some of the things that immediately that you could tell just by that initial exam? You
know, when people come to see me, you know, usually it's because they have been told that they have inflammation in the gingival tissue, periodontal disease. But there are some people that come in based upon reviews or family members that have come. And so it's I blend 3 things: the oral exam, the x-rays, and the medical history. But just looking at the oral exam, you know, this day and age, we all need to go through our normal sleep cycles. So the first thing, you know, I'm looking at, you know, the tongue. Is it coated? Is it crenated? I mean, is there indentations on the tongue that suggest there's clenching? So then I'm looking at, okay, if there's clenching, you know, is there a medical history related to stress or sleep apnea? I always ask the patient when I see a tongue that's looks crenated you know, has anybody told you snore? And you'll be amazed, 75% of the patients probably will say yeah. And so that's very important right there, because there are a whole line of things that can occur if you're not going through normal systemic issues, through normal sleep cycles. The 2 main sleep cycles, and the one stage is you want to get to the bottom of it, which is stage 3 or level 3, which is body repair. And that can, if you're not getting into that, you know, that can lead to cardiovascular issues, diabetes, dementia, you know, and then the other is REM, and that's brain. And that's where it clears the amyloid out. So, but getting back to the oral cavity, you know, we look at the dentition, you know, are there wear facets? You know, that again points to clenching. Then the color of the tissue. There are people who have anemia, and there's a burning tongue. You know, that's a sign of vitamin deficiency, particularly B12. Is the tongue coated? So that if his tongue's coated, you know, is there a yeast override? Is there medication? And then then we look at, the oral tissue. Is it moist? Is it, palpate the salivary glands to see if there's a normal flow going on. If there's not a normal flow, then we've gone from vitamin deficiencies, sleep apnea, which could potentially lead into diabetes, because if you're not going through the normal sleep cycles, you're not getting normal body repair, there's increased risk of insulin not being used appropriately. And so, that diabetes is, the 3 P's: polydipsia, polyphasia, polyuria. Polydipsia means being thirsty all the time. And, say, I have a dry mouth. Is that from medication? Is that from, the fact that maybe they are diabetic? Is there a malodor in the mouth? And, bad breath can be from 3 things: sinus, stomach, and periodontal disease. Stomach, do they have H. pylori? Then look again back to the color of the tissue. Is there red areas? Is that due to the inflammatory response to the bacteria, or are there localized areas? There are autoimmune diseases that we can see in the mouth, lichen planus, benign mucous membrane pemphigoid, pemphigus. These are all dermatological phenomena that we can see in the oral cavity that can affect other parts of the body, like eye, nose, mucous membrane areas. People with celiac disease will have an oral manifestation. And so, the key is, it may not hurt, you may not feel anything, but it's important to just get a periodic check to make sure that that it is being evaluated. So even looking at the back of the throat, anesthesiologists will do what they call Malpathy score, and that leads into, is the tongue large and closing the back of the throat, and that can cause sleep apnea. So the key is, again, if it doesn't necessarily have to hurt.
Yeah, and that's incredible what you can tell just by that initial examination. I mean, it's in combination with the history and everything else that you take a look at. But I want to backtrack real quick, because I was really fascinated by the snoring aspect. Mm-hmm. Why does snoring sometimes create creases or coating on our tongue? How does that work?
That's a good question. Your body will subconsciously try to open the airway during your sleep, and that's clenching. When you clench, it brings the tongue forward. But that clenching, it's like you take a rubber band and put it on your wrist and leave it there for a while. You have an indentation of that rubber band on your wrist. Mm. That's the indentation of your teeth on your tongue. And then again, snoring can dry your mouth out. And so saliva does 2 things. Obviously it helps digestion, but it is a food substrate for the bacteria. And so, and it's a lavage mechanism. In saliva, there are immunoglobulins and helps protect you from the bacteria. But if you have a dry mouth and it's not a normal function, your chances of a coated tongue or yeast override can occur, or a coated tongue, and that's an issue. So if snoring, your dry mouth, you're clenching, you're going to not have the normal defensive mechanism that the saliva produces or helps with. But again, saliva is also a substrate for the bacteria. People ask me, I just won't eat, because every time you eat, the number of bacteria grows exponentially for 30 minutes. And I tell all patients, brush after you eat, because you want to floss, knock that exponential growth out. And I'm not worried about acid pH, because you can rinse with water and then floss and brush. But if you're not having that normal salivary flow, it's still, you got that substrate for the bacteria to grow in, but there's no lavaging aspect of it. And so, snoring, clenching, and it can be periodic, but it's if you're waking up with dry mouth, and then the question is going to be, whoever your partner is, and you can ask them, do I snore? And they'll probably tell you right off the bat, because you're keeping me awake.
Yeah, that tends to be a very quick answer if you have a partner, and it's really incredible what you can tell by that initial exam. So you have insight into potentially sleep patterns and snoring. You have insight maybe into potential diabetes diagnosis, sleep apnea. What are some other things about our health that you can tell?
One cancer. Again, you don't have to have an irritation that you're aware of, but they can be color changes in the gingival tissue, particularly in the oropharynx. There is an uptick in throat cancer in our population, particularly men, but there's an uptick in that, and you just don't know it. But when we look in the oral cavity, we look at the back of the throat. The very volatile area is the soft palate, uvula area, tonsillar area, and under the tongue. And we always look under the tongue. So, and I'll palpate, and you can have lymph node swellings in the floor of your mouth. I don't get too concerned about that. Lymph nodes in the floor of the mouth usually is a result of inflammation from the head down. Sinus infection, periodontal disease, does indicate that there's a response going on. So then you start fishing. If you feel a lump, okay, you ask questions. Did you have a strep throat recently or sinus infection? And most of the time they'll say, yeah. And then you have a scarred lymph node that probably won't go away because it's just hypertrophy because of reacting to an antigen. Can be asthma, it can be allergy to dust and pollen. And that lymph node swelling in the floor of your mouth is a result of that. Now, again, we concentrate on the oral cavity, but head and neck is our territory. And so then I go to the neck muscle, and you do not want swelling along the neck muscle. If you have lumps or swelling along the neck, it may not hurt, but that needs to be checked out. That's lymphoma, can be cancer. You don't wait on that. The thyroid can look enlarged, and so that's a factor. But yeah, the color of the tissue, is there a normal pattern? Are there, you can have fibrotic areas, why is there overgrowth of tissue? And then we get into medication, because there's certain heart medications that if you just have a little inflammation in the mouth, the body's amazing how fearfully wonderfully made we are. If there's an irritation or inflammation, on the other side of that is healing. And there's a feedback mechanism on the cells that make connective tissue or gum tissue. But there's some, and they're called fibroblasts, but there's some that are dormant. They don't really work unless stimulated. And usually it's medication that'll do it, calcium channel blockers or dilantin. And if there's a stimulation going on, i.e. inflammation, where the immune system is going, there's something we got to get rid of. On the other side of that, body says, okay, we got to fix this. We got to heal. And you have a normal genetic predetermined amount of volume of tissue, connective tissue. But those cells that get stimulated by dilantin or calcium channel blockers will, when there's inflammation, that medication in the bloodstream will activate. And they don't know when to stop making gum. So you can have overgrowth of gingival tissue because of that. And again, you may not be susceptible to reacting to the bacteria aggressively, but once you have that overgrowth of bacteria, guess what? You got an area deeper than 3 millimeters. We call that a pocket. You can't clean it. Then it starts to snowball because the bacteria gets down in there, and whether you're susceptible or not, you're going to have an immune response, and it cycles. So, just even extra growth of tissue, why is that? We're in between two teeth. Could it be an open contact, food impaction? Is it medication? It's like Detective 101. You sort of got to start asking questions, and what medication you're taking. They may tell you snore. Do you wake up with tight jaw muscles in the morning? But yeah, it's cancer, autoimmune diseases. Sjogren's syndrome affects the salivary glands, salivary flow, dries up the mouth, and so dry mouth could be a result of the parotid gland being affected. So the incidence of pathology increases, particularly in people who drink and smoke. Again, it may not hurt, but don't get me wrong. People say a glass of wine is good for your heart. No, it's not. It produces free radicals. Alcohol does. It's the resveratrol that you want. You don't want alcohol in your system. If you enjoy your drink, that's good, but don't do it for health reasons. Do it because you just it's a social thing you like to do and you enjoy it. But alcohol also will affect sleep apnea. People, if they're having a drink or two before they go to bed, it's going to sedate them, and it's going to affect the respiratory response, and the tongue will go back to the back of the throat, and then they start to snore.
It is really incredible what you're able to tell. And one thing that struck me during this conversation is it really is so important to have this exam, because you think about how much time you spend looking into our mouth during a visit or an exam like this, and how much time our primary care physician spends looking into our mouth, and considering all these different potential health risks that you can tell from this. Like it's very important that we have this examined.
And I'm getting ready to have my primary care physician appointment next week, and I always ask them, what do you tell somebody when you look in their mouth? But the Hippocratic Oath, a physician can do anything. The Hippocratic Oath says they're anything related to the body. They can pull teeth. If they're doing something like a filling, they got to do it to the degree that a dentist does. But obviously, they don't have the credentials to do fillings and things. But they take care of the whole body. And the head and neck region is the gateway to the body. And I think sometimes they get focused on, the chief complaint, blood pressure being up, or the sugar level. They look at blood chemistries. But looking in the oral cavity, will also tell some stories.
Yeah. Well, I think we've covered the 5 main things that you can tell when you look into our mouths during an exam. Is there anything that we missed or that you all want to cover in addition to those 5 things?
Well, I think knowing medication, what it can do, is really be aware of the side effects. And don't get too concerned, because if you have osteopenia, osteoporosis, they're going to recommend a bisphosphonate or medication to help bone metabolism and strengthen the bones and make them more dense. And people are concerned about osteonecrosis for that, but really it's more important to understand, if you are taking medication, what you need to do orally to prevent it being a problem. If you don't have any inflammation in your mouth, you're not going to have a problem with the osteonecrosis. So being aware of the medication you're taking and the side effects, and then making sure that if there is a warning about infection in the mouth, talk to your dentist about it.
Wonderful. And is that our action step, to reach out to your dentist if you have any questions?
Yeah, definitely. I mean, the dentists were trained to head and neck. That's our territory. And more so because of, like I mentioned, sleep apnea. We're sort of like, physicians are coming on board with that too, but, we're sort of like see the patients every 6 months. A general dentist will do regular cleanings. I see my patients generally here because they got specific problems periodontally. I see them more often, like every 3 months or every 4 months. But I always ask, first of all, is there any concern? And then, then between my hygienist and myself, we're evaluating. And if there's ever a question and you got, go call your dentist or periodontist, call your dentist, periodontist. We have cell phones now that you can just take a picture and text it to somebody. COVID did a lot to advance, telemedicine in dentistry. And I have patients, they'd be on the coast and they'll have something come up, they'll take a picture of it, text it to me, and I'll say, well, you got to fly me down to the Bahamas and I'll take care of it for you. But no, but I can give them some advice.
Yeah, that's very helpful. And as a patient, that's comforting as well to know that you're not tethered immediately to the area if you go out of town and something happens like that you can reach out, or if timing-wise during the day, to know that option is available is very helpful. Well, if you would like to get more information about the Gum Guru podcast, be sure to subscribe so that you never miss an episode. You can also head online to NorthRaleighPerio.com. You can learn more about the podcast there. You can also learn more about getting that initial exam if you've never had one. If you would like to set up some time to see Dr. Singletary and his team here, NorthRaleighPerio.com is the place to go. That's going to do it for us today. On behalf of Dr. Macon Singletary, I'm Jason Kong, thanking you for being here with us on the Gum Guru podcast.
Thanks for watching. Be sure to like and subscribe so you don't miss more tips to keep your mouth healthy. Learn more by visiting NorthRaleighPerio.com.